Hi, my name is Paola, and in February of 2020 I was diagnosed with breast cancer. In this video I'm going to share with you everything that I did following my breast cancer diagnosis. The first thing is do whatever you need to do to soften the blow. Being diagnosed with breast cancer or with any cancer is one of the worst news that a person can get. So you need to do whatever is going to make you feel slightly better, whether it is crying, screaming, punching a pillow, going on a run, going on a walk, hugging a loved one. Please take care of yourself first and do whatever it is you need to do to feel better. Once you have done that, it's time to get on warrior mode, get on survivor mode. In order to do that, you need to schedule an appointment with a breast surgeon, a plastic surgeon, an oncologist, and a radiation oncologist. Ideally, your breast surgeon, your plastic surgeon, and your radiation oncologist have worked together. They're colleagues and they have taken patients from the first step in the treatment all the way through radiation and reconstruction. When picking these providers, there are some things that I found very helpful. The first one is, if you live in the United States, make sure that your doctors are in network. Make sure that they are covered by your insurance. And not just that the doctor is covered by your insurance, but also where they practice, where they will perform the surgeries or the treatment. You don't want to be in a situation where your doctor is covered by your insurance, but the hospital they operate at is not. So you may have to end up paying a lot of money because your insurance doesn't pay for it. Something that I realized not a lot of people ask of their doctors is to put them in touch with previous patients. This was super helpful because at the time I was diagnosed, I was 31, and I didn't know anyone who had been diagnosed with breast cancer at 31. So I asked my doctor, and he reached out to former patients, and they agreed to talk to me and share their experience with me. This was something that helped me not feel so isolated. You also want to ask, this is something that I think is very important, especially with your plastic surgeon, is to ask what percentage of your patients are satisfied with the results. A mastectomy or a lumpectomy can be very hard surgeries for your body, and you want to know that these doctors have done this enough times, and you want to know that the patients are satisfied with the results. Another thing that is very important is to ask for pictures. You can ask for before and after pictures. You can see, in some cases, you can even see like before, during, and after pictures. And that is something that you want to know the results of these particular providers. Once you have the initial meeting with all of these doctors, I encourage you to get a second opinion. Cancer treatment is a long and windy road. You're going to be seeing these providers for at least a couple years. These are going to be long-term relationships. So you want to make sure that you not only trust these doctors professionally, you not only trust them as doctors, but you also like to spend time with them. If you do chemo, you might be seeing this provider every week for 5 months. So you want to make sure this is someone that you feel comfortable sharing your most intimate details. Let's say you're a person who is very optimistic and likes to ask questions and likes to have an input on their treatment. Well, then you should make sure that your doctor is also optimistic and is a doctor who is happy to answer your questions and is happy to take your opinion into consideration. Maybe you're someone who just wants to be told what to do. Then you should look for the doctor who is happy to take the lead and tell you what to do. Or maybe you're someone who wants a doctor who will be like happy to hold your hand and be very warm and fuzzy around you, then you should make sure your oncologist, especially your oncologist, is not only a great oncologist, but also has those soft skills that will make your time with them easier. Once you have assembled your care team, if you're of childbearing age, I encourage you to ask about fertility preservation options. I know some doctors bring it up, and I know some other doctors don't. I think if you're young and you want to have children in the future, I encourage you to ask for it. A resource that I found very helpful when I was looking into fertility preservation myself was the Life Strong Foundation. I plan to make another video about this, but they were a great resource and they help finance some of my fertility preservation treatments. Once you have settled on your breast surgeon and your oncologist, I strongly suggest Naturopathic Oncologist. I had a naturopathic oncologist in addition to my oncologist, and I'm very grateful that I had two oncologists in my care team. They both worked together. They both agreed on all of my treatments. And in addition to chemo, I was also getting a lot of supplements to make my chemo even more effective and to help me with the side effects. The next component of your care team, I didn't think about it, but it's a very important component. It is a therapist who specializes on treating people with cancer. Cancer is as much emotional as it is physical. And you want to make sure that you have someone to talk. It could be once a week, every couple of weeks, once a month, who provides emotional care to people going through cancer. There are a lot of emotional aspects that are very particular to cancer that I know my therapist helped me with a lot. Last but not least, you should reach out to a physical therapist who specializes on post-mastectomy or post-lumpectomy rehabilitation. We get a lot of trauma to the chest, and that can affect our shoulder range of motion, our arms, our pecs. So you want to make sure that you're talking to a physical therapist even before you have surgery. So you establish your baseline as far as range of motion, your baseline as far as circumference, arm circumference, so that you know what you were before. Thank you for watching. Please reach out if you have any questions. And just remember, this is not professional advice. This is just what I learned as I was going through my own breast cancer journey. Thank you.